Welcome back to Meds Made Easy. My name is Tarun, and today we're going to talk about Naproxen, or as you probably know it on your common shelves at stores as Aleve. Perfectly great drug. It's a great anti-inflammatory. More specifically, it's an NSAID, non-steroidal anti-inflammatory. It can really be used for anything. Anything related to back spasms, pain, you hurt yourself, you cut yourself, whatever. It can be used for anything pain related, inflammatory related. You pull a muscle in the gym, you get into a car accident, whatever. These are great medications to take. If a headache, people take it for headaches. And you can. All of this stuff is indicated for that. You could even take it for management of like gout. I could go on and on for days what you could use this medication for. It's very versatile. I call it the cousin of Advil. So ibuprofen is Advil. You can use it for the exact same stuff. You can use that or this, doesn't matter. Just whichever one works on your body. That's the key. More specifically for all the nerds out there, it's a COX-1 and 2 inhibitor, but for our purposes, we're talking straight just who, what, when, where, and why. It's an anti-inflammatory, right? It can bring down a fever as well. Not really the most effective medication for that, but it can as well. So if you are, if you have an infection or something like that and you have pain, this will take care of the fever as well. So it'll take care of the pain and fever. So it's good stuff. Definitely take it with food because it's an NSAID, non-steroidal anti-inflammatory. It will tear through your stomach, right? Your stomach lining. Prolonged use of this definitely mess up your stomach. So try to take it with as much food as possible. Take it after a meal, and what that does is it keeps your stomach settled and it prevents it from getting irritated. Let's see here. It's a quick onset. I mean, we're talking the onset of this drug is 30 to 60 minutes. It kicks in quick. Stays in your system for a long time. So that's one of the big differences between this medication and ibuprofen or Advil. A lot of patients come and ask me, well, which one should I take? Well, it doesn't really matter which one you take. It's whichever one works for you. And then two, depends on your schedule. Can you take, because Advil is meant to be taken every 4 to 6 hours. Are you going to be doing something? Are you going to be at work where you can't have access to, pills and things like that? Then maybe it's better to take Aleve, because Aleve is taken every 12 hours because it's a long-acting drug. And again, after 12 hours is when most of that medication is getting cleared out through your system. You can take another dose again. So longer acting, which is really good for that. Kids starting 2 and up, you can begin to take this medication. I won't go through dosages. It is just so much. There's tablets out there, there's liquids out there. You can take it so many different ways. So I'm not going to go through dosages. But again, like I told you, relatively, especially if you're taking it orally, every 12 hours you can take this medication. Let's see here. So one kind of complicated thing, and I'm not going to touch on too much of it again, it's getting a little bit too scientific. There's such thing as naproxen base and naproxen sodium. Generally the upper limit of naproxen you can take is like 1100 if you're taking the naproxen sodium, which is a different version or a chemical version than the base. Again, I think I'm getting too much into it, but the base 1,000 milligrams is the highest. Point is, if you're taking about 1,000 milligrams of this stuff, that is your key to know that you're probably maxing out. You shouldn't take any more than that. It could cause issues, and I'm about to get to those issues in a bit. Generally about 200 milligrams of the base is equal to 220 milligrams of the sodium version of it. So kind of gives you an estimate on how to go about that. Renal, this definitely hits your kidneys hard. So prolonged use of this can really mess with your kidneys. You don't want to do that. If you're on medications that already go through your kidneys, this is going to add that extra stress to your kidneys. We don't want that. So make sure your doctor's in on the loop. Liver's not affected too much, but again, when you're on a bunch of different medications, you just don't know. So make sure your doctor's in on the loop. And a lot of people will use different doctors for different things. Make sure they're all in on the loop on what medications you're taking, because that is the number one problem we see, is that this doctor doesn't know that this doctor prescribed this, and it's going to interfere with what he's about to prescribe, and then you end up with problems. We don't want that. Let's see here. If you're pregnant, you do not take this medication. Crosses through the placenta. You don't take NSAIDs when you're pregnant. It damages the baby. Not cool. We want our babies to be safe and healthy. For the mamas out there that are lactating, breastfeeding, it does have something called an RID, relative infant dose. So as long as you're beneath that level in your breast milk, you're fine. If your breast milk has way too much of the med, it'll start to harm the baby. We don't want that. Let's see here. It has a black box warning, so again, when you're taking like 1,000 milligrams or more, you're going to put yourself at a very increased risk of myocardial infarctions, heart attacks. Yes, you can get a lot of cardiovascular issues with this medication if taken in high doses or prolonged periods of time. So for people who already have heart conditions, you do have to be very careful with medications like this. Yes, you can get it over the counter. It's generally a very benign medication. I'm a perfectly healthy individual. I have no issues. So for me, it is a benign medication, but for someone who has a heart condition or super high blood pressure or anything like that, you need to watch out. Because yes, for people who have high blood pressure, you need to watch out with this medication. The NSAIDs tend to raise your blood pressure. We don't want that either. We want to make sure you're controlled. Also with GI bleeding, like I said, the stomach thing is horrible. So if you take it for a long period of time, you're not taking it with food or maybe even an acid reducer, we can I'll talk to you guys in the comments about that if you have questions about that. But if you're on it for a very long periods of time, you need to start taking an acid reducer with it, because what can happen is GI bleeding, essentially your gastrointestinal system starts to bleed, your intestines, your stomach, and bleeding anywhere in your organs is a very, very bad thing, cause harm to your body. So we don't want that, guys. So you need to watch out for that. There's black box warnings for both of those things. And you go, hey, Tarun, well, how is this available over the counter if it's got these black box warnings? Well, again, like I said, if you're a perfectly healthy individual, it has no bearing on you. But if you do have these predispositions to it, let's say you already have gastroenteric reflux disease or acid reflux, and you need to be on this medication because you got into an accident or you pulled a muscle, you gotta watch out for this, because then it will kind of mess with your system extra. So if you're kind of compromised in that sense, you need to watch out, okay? Put up a list of side effects here. The most important thing about this medication is it is a very generic and broad anti-inflammatory, and so the side effects can be broad too, right? When there are certain medications that target and affect you only just this narrow, that means the side effects are narrow. But when you have a wide, broad spectrum medication like this, your side effects are going to be, you can have all kinds of abdominal issues, right? Cramping problems related to kind of like the GI system, as well as edema. You could end up, again, it messes with your kidneys, and your kidneys regulate your liquid in your body, right? You excrete, if your body's retaining too much water, it's on your kidneys to get rid of that liquid. So if your feet end up swelling up or your hands swell up, well, that's not a good sign. The medication could be a cause for that. So edema, palpitations, again, like I said, there's already issues with the heart. So if people with issues could end up having like racing heart issues, super high blood pressure. I've known some patients who've taken just one dose of Naproxen, 220 milligrams, which is just one tablet of Aleve, and all of a sudden their blood pressure shoots up to 180, and that is very dangerous. I've even seen it go as high up to 220. We had to send the patient to the hospital for that one. That was just not safe at all. Dizziness, drowsiness, those are all, again, part of what you can see with the medication, but it's just a very large range of outcomes. Guys, but I hope that's it. Again, I try to make these videos short. This one didn't end up short, but I'll do better next time. Leave any comments, concerns below if you want to know more about the whole acid reflux thing with Naproxen. We'll talk about it in the comments. Subscribe, let us know how we're doing. We're just trying to make these videos to help, guys. If you have any medications you want us to talk about, we'll do it. Send it our way. We'll tune in next time, guys. Thanks. Bye-bye.